Essentially, I felt lobotomized, to be honest with you. It was very hard to learn anything. Kind of the typical what you hear from someone who has PFS or PSSD, like the cognitive effects, emotional blunting, numb skin, numb genitalia. That's kind of one of the telltale major signs of PSSD or even PFS at this point, of course. Like digestive issues.
Sure.
I felt like I kept having issues with using the restroom. I'd be, constipated for a long time, and
Yeah.
that has just now kind of gotten back to normal. I completely knew it was the SSRI. I mean, nothing else changed, so
Okay.
it's logical. And I think some people don't, you know, have the awareness to think, okay, it's the drug doing this, considering how it was before and then after.
Hey, what is going on, guys? This is Mark Millick here with the Moral Medicine YouTube channel. Today, I'm going to be interviewing Jonathan. So, Jonathan is a PSSD patient who's had PSSD for, I believe, about 5 years now. PSSD stands for Post-SSRI Sexual Dysfunction. I believe that's correct. So, Jonathan, thank you so much for joining us.
Absolutely.
So, let's get started here, man. What was your life like before you got PSSD?
So I was highly motivated. I was 19 when I first got PSSD, and essentially I just started. I'd always been kind of an anxious person from like age 15 and on, essentially. So, um, yeah, I was just really anxious and highly motivated, and that's basically what led to me taking something because I was so anxious. I realized, maybe if I'm not as anxious, it will help me be more productive business wise.
Sure, absolutely. So, you took it basically for anxiety. What particular SSRI did you take?
So I started with Lexapro. I took 10 milligrams, and I took that for about a week and a half, maybe 2 weeks, and my anxiety went through the roof. So I had a really bad reaction to it.
Wow.
Yes. And then after that, my doctor put me on Paxil, paroxetine, and I took that for about 8 weeks.
Okay. So pretty short-lived for you then. I mean, you took it, you had a bad reaction to it, but the second SSRI you took, did your anxiety increase? Did you notice any changes, or how did that go for you before you came off? Because you only took that for 8 weeks, you said, right?
That's right.
Okay.
So overall, I started feeling a little bit better, to be honest with you. I felt a little bit calmer, and I thought, okay, I made the right decision. And so, um, but I started noticing that I just felt really flat. And so, just as an example, like we have a boardwalk here locally. So I went to the boardwalk with my parents um, because it was around my birthday, if I remember correctly. And
Mhm.
I just started feeling super flat. So things that felt fun weren't fun at all. And I knew it was the medicine, of course, but
Sure.
yeah.
So that was during the time you were taking the medication. You started to feel flat, and I guess probably just less interested in things that you normally had an interest in. Um,
Yes.
and so you decided to come off it at that point in time, then, right?
So I pretty much decided, okay, I'm going to keep pushing through it. Maybe it's just my body adjusting. And so I felt like that was kind of, a normal response considering I'd never taken any sort of medication ever in my life.
Sure.
So I pushed through it. I started noticing that I literally felt like I could stare at the wall all day and be
Yeah.
entertained after a certain point. I mean, so going from being the super motivated person I was to all of a sudden I am just flat all the time. I'm not
Yeah.
motivated. I'm, like I said, literally entertained by doing nothing after a
Right.
certain point.
Yeah.
Um, that's when I decided, okay, this is not me. This is not who I am. So I came off the drug, slowly tapered off.
So that's a weird feeling. So as you know, I'm a PFS patient,
Yeah.
obviously. So I know that feeling of just blunted emotions where you go from being somebody who's highly motivated to all of a sudden having no interest in doing really anything. I mean, I lost interest in my job, I lost interest in sex, I lost interest in my hobbies and everything. And that was the complete opposite of who I was before. So I really do. I feel for you on that. Now, when you came off, did any of those feelings subside? Did you have a period of relief temporarily, or kind of how did that go?
So I can remember this pretty vividly. I came off and I started getting really bad brain zaps for one.
Okay.
And some of the feelings were slightly worse as far as like the lethargy, things like that, that those kind of intensified a bit, but I felt like, okay, this is probably normal. My body's adjusting to something it was dependent on, even though it
Sure.
was short lived.
Right.
And so Probably 2 weeks after coming off of it, I started feeling a bit more normal, and I thought, okay, I felt good that I was feeling more normal, and I was really looking forward to kind of getting back to normal. And then all of a sudden, I feel like I crashed. So I remember walking outside. I was actually going to do some work outside,
Sure.
and all of a sudden, it was like I went from being like I was this close to being back to normal to just I was back to square one basically, and it just stayed like that.
And that was after about 2 weeks. You felt a little improvement, and then you went out, and the next thing you know, you just basically hit ground zero again. And
Exactly.
so that was what, 5 or 6 years ago, then roughly. I think you said 19. I think you
five
were.
years and so 5 years and 3 months at this point.
Okay. Has anything improved for you?
Yes. So I've seen some improvements.
Good.
Um, it's been very gradual, and I'm glad that I've improved. But I mean, even just recently, some of my brain fog, I still had brain fog, and it's slowly kind of subsided.
Okay. Okay. So it wasn't just the emotion, you also had brain fog as well.
Oh yes, I had essentially, I felt lobotomized. To be honest with you, it was very hard to learn anything. Kind of the typical what you hear from someone who has PFS or PSSD, like the cognitive effects, emotional blunting. Um, but I was so out of it for so long, even after discontinuing the medication, just like cognitively, that some of it bothered me to a point, but it also didn't bother me as much as I feel like other people are bothered by it because I was so, like I said, just
It's what
dysfunctional.
Yeah, it's weird.
So
It's like you don't care, but you also don't care about the fact that you don't care. I don't know if that makes
yes,
sense to you, but like
it does.
normally, yeah, if I was almost like, it's hard to explain, but yeah, you're almost like you're so blunted, you're unconscious about how this should ultimately feel,
Yes,
which is almost like when you start to improve a little bit. I don't know if you've had this, but for me, like as I've gained my emotions back ever so slightly, it's almost like the severity of this starts to set in a little bit, and
yes,
it almost becomes more depressing because you're like, wow, I've missed out on all this over the past several years, and I haven't had these emotions in so long. It's almost like it's just this. It's a horrible feeling, that you can't even really begin to describe to people. Now, you mentioned the brain zaps as well, because that's actually not something I hear a whole lot from PFS patients, but I've had it
yeah.
myself. I've talked to a few people about it. Can you explain that? Because for me, it was like a shock, like in the back of my head.
Yes.
I felt it specifically.
So that's pretty much spot on for how I felt. I felt it more like at the top of my head and even somewhat in the front. But it was like I would be sitting there, and it's almost like if someone dropped a pin
Mhm.
in your brain in a way.
Yeah.
It's a strange way to describe it, but that's how it personally felt for me, and it felt like like a shock as well. Like it just kind of depended; it would vary, but um, you're pretty spot on with what you said.
Yeah. Did it kind of make you jolt when it would happen? Or
Not necessarily, not for me at least. It
sure.
was more just in my brain.
Sure, and it varies for different people, obviously. I'm just curious about that because for me, they would kind of come on and it would be like a series of them over the course of several minutes, and then it would kind of dissipate, and then I
Okay,
might have to do it again for a couple weeks or a couple days at a time. Was it like that for you, or was it more consistent?
it would kind of come and go, to be honest with you. And once it stopped, I've never had one again. To be
Okay,
honest with you, I feel like those only lasted probably 2 or 3 weeks,
yeah,
in total.
and that's actually relatively common for people who are coming off an SSRI. At least that's what I've
Yep.
read about. So that's a pretty common symptom, but it doesn't seem like doctors really know what that is ultimately, though, or what sort of the cause of that is, which should be, grounds for concern. But
Yes.
so I guess having said that, did you talk to any doctors about this? Did you go to your primary care physician or mention this to them?
I didn't. I honestly kept thinking I would have windows of recovery too, which, it's pretty common, I feel like. And so I felt like, okay, as time went on, I felt like I was recovering. And so I guess sort of, I felt like I had more windows here and there sort of thing. I haven't had a window in a long time at this point, but,
Sure.
um, the more that I had windows, the more that I felt like, okay, I'm kind of on my way out of this to some degree. So
Yeah.
I think in between that and then, like you said, you just don't really care. Then
Right.
um, I didn't really feel the need to talk to my doctor, and I think to some degree I felt like I had briefly mentioned it I went to the doctor during the withdrawal period
Sure.
for something completely unrelated, and I briefly mentioned, I feel like I'm kind of still trying to get back to normal, and he just completely ignored it. And so I kind of took that as a sign. Even being in the state I was in, I felt like, what is he going to do? You know?
I guess out of curiosity too, I should have asked you this before. Did you know kind of what was happening to you when you came off it? Like, did you do research and you heard about PSSD, or were you kind of just assuming that this must be the SSRI, and I guess this is how life is now? Or what were your thoughts with that, or kind of what happened?
So I completely knew it was the SSRI. I mean, nothing else changed. So
Right.
it's logical. And I think some people don't, you know, have the awareness to think, okay, it's the drug doing this, considering how it was before and then after. That's the
Right.
only change. But
Right.
I was pretty hyper aware, which is a part of the reason why I used the drug in the first place.
Mm.
So for me, I just already knew what that was, and I had done
Yeah.
research, but it was still withdrawal was relatively new too. I'll say, like, people or the internet actually recognizing that to some degree,
Yeah.
because when I went on and I looked, it said, there were various different articles that would say, you should be over it within like 2 to 4 weeks, antidepressant withdrawal, just to be
Yeah.
specific.
Yeah.
And so I kept thinking, well, I'll get back to normal, so that kind of reinforced those same thoughts.
Right. Right. Absolutely. Uh, was there any heads up though before you took the SSRI that you could potentially deal with permanent or semi-permanent symptoms, like when it came to the withdrawal?
Absolutely not.
Okay, so your doctor didn't tell you about any of this.
No. He
Okay.
informed me of the side effects on the drug. He never told me about the withdrawal, potential coming off the drug, or even the semi-permanent or permanent side effects that could continue.
But you know yourself that obviously, look, this is the sort of the lowest common denominator in my life here. I mean, I took this drug, I came off it. Now my perception has completely changed. It's got to be the drug. Because that's kind
Yes.
of how it is with a lot of different people. For me, when I was taking Finasteride, I didn't even know that Finasteride could cause some of the symptoms I was having. I had really severe brain fog. I developed a speech impediment. And I came off it just to test to see if Finasteride was maybe the cause of it, and hopefully everything would go back to normal. That was my hope. And then all of a sudden my body crashed and I changed, and I developed, not, I don't know, 30 new symptoms over the course of like 6 weeks, man. It was crazy.
Yep.
Uh, but your symptoms were kind of just confined to brain fog and then emotional blunting. Anything additional to that?
So I had some of these things have improved, so I'm having to think back a little bit as well. But like numb skin, numb genitalia, that's kind of one of the telltale major signs of PSSD or even PFS at this point, of course.
Yeah.
So I also feel like, obviously, when you have numb skin, I couldn't really feel my muscles contracting. And
Yeah.
so it's
Yeah.
like I was going through the movements, and um, things just weren't right overall.
Yeah.
Even, I had sensitivity to sunlight. That was something I had on Paxil, and then it continued off of Paxil for some time. That went away.
Yeah.
Trying to think if there's anything else, but mainly just all of the major issues of PSSD. I mean, even some of the like digestive issues.
Sure.
I felt like I kept having issues with using the restroom. I'd be, constipated for a long time, and
Yeah.
that has just now kind of gotten back to normal. And I think that pretty much covers the bulk of the symptoms. It was, if you go and read any recent papers on PSSD, it's pretty much every single symptom.
Yeah. Absolutely. Look, I'm glad to hear you've improved to a certain extent with some of your symptoms, at least. I think post-SSRI sexual dysfunction kind of undersells the entire sort of symptom list associated
Yes.
with disease, right? Because I mean, you think it's just sexual dysfunction, and I don't want to downplay that because that's life altering in itself. But
Yep.
then you have the brain fog and the emotional blunting, and you have the numb skin, and I think you mentioned to me offline you're a personal trainer as well.
That's right. Yep.
Okay. Just out of curiosity, has this affected your career at all?
The more that I've come out of this, no.
Good.
And I honestly, not to pat myself on the back, but I had a much stronger mindset than I feel like a lot of people have when they develop something like this. And so I kind of thought, this is the drug doing this to me. This is not who I am as a person. And I just kept on, for the most part, always trying to do what I would have done anyways, even if it was 10 times harder.
Yeah, I appreciate that mindset, man. Look, I mean, I think with anything in life, it's a bit of a mindset, right? I mean, even when it comes to hopefully finding targeted therapeutics for this one day. I mean, we need
Yes.
to continue fighting as a community and coming together. I don't know if PSSD and PFS have the same root cause, but they certainly overlap in a lot of different ways, obviously. So
Yes.
you coming out and telling your story here is honestly one of the best things that you can do. I really appreciate you stepping up here and sharing this. I want to see more people start doing this because this is really what it's going to take to ultimately, get out of this. So to your point, I mean,
Yeah.
mindset, it's really everything. I mean, I've tried to maintain the discipline of kind of living my life the way I did before. I had PFS. I still go to the gym. I go to work. Everything is literally 100 times harder now, but I'd rather at least know I've got the discipline to push through it as opposed to just saying, well, this has defeated me and I'm going to just not do anything anymore, right? My life is now going to
Yes.
be completely just taken over by this disease. So I appreciate that mindset. I don't know if I asked you this. Did you talk to your family about this at all or your friends?
Not for a while, to
Okay.
be honest with you. I talked to a couple of family members about it,
Yeah.
and how I said, I would tell them that I felt like I wasn't back to normal, for the first couple of years, and
Sure.
I don't feel like I really. I told I don't feel like I really shared the severity of it until more recently, as far as like what I dealt with, and like I said, things have improved, but I'm definitely not. I'm not 100% by any means. I'm like 50%, maybe even 60, but that's better than being at 10%. So
Yeah, absolutely, man. Was there any surprise from your family or your friends? Like, were they like, "Oh yeah, we did notice some shifts in your personality," or were they just like, "Oh, we had no idea"?
so they definitely noticed some shifts, but I think it was more of like the nonchalantness and just
Yeah.
somewhat coldness, because when you're anhedonic, honestly, it's hard to. I think people confuse anhedonia with calmness, and so they don't realize, like, okay, you're stoic because you just don't feel anything,
Right.
and so um, I think that's a lot of what they saw, and they've seen improvements, but that's
Yeah.
the main thing they saw is the lack of caring, and then just the stoicism, essentially.
Yeah, like the lack of reaction you have to like
Yes.
anything. I mean, I used to be a
Yeah.
very just sort of just very expressive person. I would kind of I'd raise my voice, but not like out of anger or anything. I would just get excited, very easily about things. And I kind of just I went from that to kind of just like just oh, all right, whatever, just shrugging. And you so desperately want to care about what's
Yes.
happening around you, but you can't fight that. And it's hard to explain too, because for me, it's like you care, but you don't care. How do you even really explain that to somebody? It's like you care
Yes.
about not caring, but you can't change that. Uh, I
Yeah.
used to be really into like reading books. I would read like one book a month. I don't know if you had this, but I would read all the time, and I went from doing that to I haven't read a book in 2 years now. I try to, but it's tough
Yes.
to process new information and to visualize as well. Did you ever have any issues with visualization?
Absolutely. I had that for a long time,
Yeah,
and that's gotten somewhat back to normal, but
yeah.
it's not quite where it was, but I'm just grateful for where it is.
That's good, man. Yeah, I appreciate that mindset. Yeah, for me, when I'm trying to explain something to somebody, usually you can kind of see it in your head and you explain what you're visualizing. When you can't
Yes.
visualize something, it's like it almost ties in with the brain fog. It's like I'm trying to explain this, but I can't see what I'm trying to explain. It's such a weird
Yes.
feeling. And only people who have like true anhedonia, know that what that's like.
Yes. And
Um,
I also play guitar, and so I've
okay,
played
cool.
for like 12
Awesome.
years now, and
Yeah,
that really affected. Just to speak on some of the cognitive dysfunction that you were talking about,
sure.
like for a long time it was very hard for me to learn anything new on
Mm,
guitar. So, and I'm not to pat myself on the back once again, but I'm an advanced level player, and so
sure.
when I'm trying to learn something more complicated and I can't do it, and it's like I feel like I have a learning disability.
Right.
Um, you know that bled into every facet of my life. Whether it was making a program for a client, or I actually got a couple of certifications in the interim of having this, and
For you, man.
um,
Awesome.
it was way harder doing all of that.
Yeah, yeah, absolutely. And you mentioned music too. I mean, you play guitar. I kind of dabble in guitar. But I lost like the desire to want to listen to music at all. And I still don't have.
Yes,
For me, listening to music almost like makes me depressed because it brings me back to a time that I can no longer really enjoy, if that makes sense. It gives me all these old
absolutely.
memories. And so it's almost just it's like nails on a chalkboard to me. So I would
Yes.
imagine you playing guitar, that was probably a big loss for you. You've been playing for 12 years. You were passionate about it. I mean, I don't want to put words in your mouth, but I'm assuming that was probably something that was really tough to cope with in the beginning stages.
So even when I was on the medication, that was one of the few things that I still really cared about. And
Yeah.
so, um, even now I can feel music just a little bit, you
Yeah.
know, and I mean, it's not, I used to have a very deep connection when I listened to something. I'm sure you did as well, based on what you were telling me. And, so I remember when I had a window, um, shortly after I, came off Paxil, and I just burst into tears, and I couldn't believe that I could feel music. So, it's something that the normal person would take for granted. And unless you have something like this, and then you redevelop that connection, um, I don't think people will ever understand, you know. So
Yeah, yeah, something so small that, like you said, you take for granted every single day, listening to music, man. I used to listen to all kinds of music. I would listen to rap. I would listen to EDM. I used to love listening to the Chainsmokers, especially back in college. I love
yeah,
listening to Frank Sinatra. I love classic rock. There was one time, probably a little over a year ago, I think it was December of 2022, so about 6 months after my crash, I had one day where I could kind of feel music again. And I was sitting here at my desk right here listening to some classic rock, and I started to almost tear up, man. Like the
yeah,
emotion was so overwhelming. And I felt decent that day. I mean, it's not like everything returned, but I felt something was sort of clicking back on. And I was thinking to myself, maybe this is me somewhat recovering. And then the next day I was blunted again and couldn't feel a single thing. And it's just like that. So I guess the good news is that, we can speculate that whatever this is, once we turn this back on or shut it off, whatever it is, right?
yeah,
Then everything will hopefully come back online relatively quickly. I mean, if I could have these short windows, and you've had windows every now and then, it shows you that there's something your body's attempting to reach, sort of the state of equilibrium. We just got to figure out where that is and what the root of it is.
yes.
Um, so a couple more things I want to ask you. Did you try focusing on your diet at all? Did you try any supplements or anything? Just out of curiosity.
So I've tried some different things, and that's a part of why I've seen improvements recently.
Sure.
So I will say that I wouldn't, like, me saying that isn't condoning other people trying things
Sure.
themselves. I don't want to dissuade people from trying, but at the same time, um, I definitely could have made myself worse at the same time. And I feel like, you've read that, of course, and heard that
Yeah.
at this point.
Yeah.
So,
No, I appreciate you putting that sort of disclaimer on there because I know a lot of people who have tried, different protocols, different vitamins, different supplements, and they have just crashed themselves so much harder. Their baseline completely lowers. They're much worse off than when they started. So you really got to be careful about those things. I mean, that's why we push research so
yes.
intensely, because that's really what it's going to boil down to. And I think we can honestly do this in a reasonable time frame if we all just collaborate and come together.
Yeah.
Look, I mean, I don't know what the exact percentage is of people who have PSSD, but I think it's probably higher than we know at this point. I mean, SSRIs are running rampant, man. I mean,
Yes.
you went to a doctor to get yours, right?
Oh, yes.
Yeah.
Absolutely.
Well, you can go on all these different telehealth companies right now and pretty much be prescribed an SSRI. I mean, just like that, just as quick as I
Yep.
was prescribed Finasteride. So this issue, I think, is really growing. I think there's probably a lot of people who are experiencing things like emotional bluntness who haven't connected it to the SSRI yet, or finasteride, or whatever it is they may be taking. But I think we definitely have enough people here in the community where if we all just come together and just combine our resources, we can absolutely find a way out of this. We got to figure out what the issue is first, what the root of it is. But once we do, we can start working on targeted therapy. So
Yep.
I encourage everyone to donate. I'm assuming you donate to the PSSD network. I donate to the PFS network. Either way, I'm going to just tell people just donate to something. I mean, just commit to some sort of research at this point, and to also go public, because the more people that come out and talk about this, the more legitimized this disease ultimately becomes.
Yes.
So, yeah, Jonathan, I really appreciate it. Yeah, again, man, you sharing your story. Before we jump off here, do you have any closing statements you want to make?
I will say, excuse me, we're in complete agreement on coming together as well. I've kind of talked about that
Sure.
outside of this interview, but you know, the more that we come forward and get this resolved, I mean, like I said, I've seen improvements, but I want to get back to 100%, just like everyone else who has this. And so, it's like Mark made me feel very comfortable during this interview. and just to tell you all that in case that's, a worry there. But um, stepping up is the hardest part, but the more that you do it, and there is embarrassment, I feel like for a lot of people, and that's why they don't say anything. But at the same time, there's nothing really to be ashamed of when, like I have a clientele, and I would hate for them to see this, but at the same time, it's not my fault that I was prescribed something that left lasting effects. So there's nothing for me to be ashamed of or embarrassed about when it's just simply not the result of me doing something wrong. It's just the current system that's in place is not supportive of treating this. So I feel like the stigma, the shame, and like I said, the embarrassment will, I feel like it'll subside, over time, essentially. And if you just step forward, it's a big part of getting this fixed.
100%, man. I'm really glad you mentioned that because there is no reason to be ashamed of any of this, whether you have PSS or PSSD or post-Accutane syndrome, also known as PAS. Look, you were given something that you were told was safe. You were damaged by it, and now you obviously want to get better. You want to recover. There's nothing to be ashamed about with that. And I think the issue too is that at this point, so few people have stepped up that it's very isolating. You feel alone to be kind of one of the few that have gone public. But if all of a sudden over the next year we had 1,000 people go public about PFS and PAS and PSSD, you wouldn't feel so alone, and the stigma
Yes.
would be completely eliminated at that point. So every single video is moving us closer to that point, which is just phenomenal. And I like how you mentioned too, you want to get back to 100%. I mean, I
Yeah.
do too. I set very high standards for myself. I want to see the community set those high standards for itself as well. I want to get to 100, man. I don't want to take 80, 85%. I don't want to take 55%. I don't want to just get a little bit better, where I can manage my symptoms. I want a full out cure for this. And I want to get my
Yes.
life back to where it was before. So I think we got to set higher standards for ourselves with both, again, PSSD and PFS with getting recovered from this. I don't want to take anything less than 100%. We deserve 100%. So, yeah, Jonathan, again, I really appreciate you stepping up, man, and going public and telling your story. Again, there's nothing to be ashamed of. If anybody's interested, they can reach out to me. I'm more than happy to feature them on this channel. I've also told people too recently, if they want to send in their own videos, if they don't want to do an interview, because an interview can be a little bit, intimidating at times. But if you want to just send in your own personal testimony, 5 or 10 minutes, and talk about your story, we're more than welcome to feature your video on this channel as well. So, either way, two most important things: donate to research and go public. So, having said that, yeah, thanks again, Jonathan. Thanks so much for joining us, man. And we'll see everyone next time.